They will come. They will come into an urgent care or acute care center, and physicians like me would take care of them. So imagine your UTI that started overnight and you couldn't wait, or children with really bad ear infection, or your allergic reaction from a bee sting. And sometimes we also see people that are just regular, everyday high blood pressure, diabetes, need refills of their medications, but for some reason or the other, they can't get in to see their own regular doctors. We will step in the gap and help them until they're able to see their doctors. Sometimes we do get really sick patients, people with like strokes, heart attack, and things that are beyond our what we are set up for. And in those cases, we'll just stabilize those patients and help transfer them to the ER. And many hospitals in the US right now actually have that framework where they have an urgent care and then have an emergency room right next to each other, so that they would decongest the ER and the ER physicians are not overwhelmed. I'm board certified in family medicine, but just decided to do more of acute care than chronic care or chronic condition management after residency. Okay, enough about me. This is another episode of the OAU Med Talks, the Edge series. And today we will be talking about saving lives outside the clinic. And like one of my colleagues shared with me earlier on, think about the things that you do every day in your day-to-day activities that is outside of the clinic, but is impactful or helping others. Whether it's that grandma that stops you at church and say, "Omo mi, bami wo fun pa mi," or it's your colleagues who would run things by you, or you're the only doctor in your family, and auntie's uncle's cousin friend, is sick somewhere, and they say, "Call my brother and let's run it by you." Or say, for my case, extended family just randomly send blood work to me on my text, on my phone, and say, "This is Mr. and Mrs. So labs, take a look at it, advise us." So things that you do on a day-to-day basis that impacts the life of others. And I was also thinking, even this forum, we're impacting each other's lives, we're impacting the lives of the generation that are coming after us, so that they in turn can also impact others, both the community and doctors that would graduate after us. Our hope is that we will pass this on from generation to generation. So let's just think about things that we do, even though we're all doctors or people that are in the healthcare delivery system, but things that we do on a day-to-day basis to save lives, to impact others, and just to make this earth a little bit better for each and every one of us. Our speaker today is Dr. Muyiwa Tegbe. He's a friend. He's also a graduate of the 2005 class. He's a brother and he's a colleague. And to tell you a little bit about him, Muyiwa Tegbe is the Deputy Director for the Primary Health Care at PATH. And this is a Seattle-based global health organization with operations in over 70 countries. Muyiwa is a health policy and health financing expert with significant experience working the United States, Africa, and Southeast Asia. He also has significant experience leading evidence generation activities, program and policy analysis, and implementation of interventions that improve access to healthcare and financing for health systems. He has strong interest in developing financially sustainable health systems that will deliver improvement in population health outcomes and delivery of health system values. Muyiwa has also worked as a consultant to life sciences and managed care organizations, leading to evidence generation activities to support better understanding of unmet needs, quality of care access, and broad policy impact analysis. He led the preliminary assessment of value-based oncology reimbursement models for a major US-based pharmaceutical company. He has conducted business feasibility assessments and profitability analysis for African-based investor groups that are interested in making equity contribution in tertiary hospital startup projects in Nigeria. I know that's a lot of English, but Muyiwa is the epitome of a physician that is saving lives, even though he's not seeing patients on a one-to-one basis in the clinic. And without any further ado, I'm going to pass the baton over to him and let him teach us a little bit. Thank you.
Thank you so much, Lola. I hope you guys can hear me.
Yes, sir. Yes, sir. We can hear you.
Thank you so much. Thank you so much, everyone. This is, when I was listening to that, I was like, huh, is that me? But anyway, thanks a lot for being here, and it's a privilege to be part of this series. Let me start off by saying, I know I have some friends who are on here and some people who are external to OAU. But this is a series that we started a couple of months ago, just to provide mentorship and to provide some guidance to current students of Obafemi Awolowo University. And just so that we, a group of us came together in our class and just identified that there were gaps in mentorship and guidance when we were students. And we decided that we wanted to right that wrong, so to say. So that's why we started this Edge series. And it's a monthly talk whereby we highlight the accomplishments of different members of the 2005 class, and just so that it inspires and it inspires current medical students, and also be able to provide some guidance to them as well. We're also starting a mentorship series, which has been dropped into the, and you can reach out to us if you're interested in that. Okay, a little bit about me, just to add to that. How did I get to where I am right now? My name is Muyiwa Tegbe. I 2005 class, and for me, I'm currently a deputy director for primary healthcare at PATH. It's a global health organization whereby I do a lot of policy work, and I do a lot of program implementation around the world. Right now, I'm actually working on a project design for Uganda, for USAID Uganda. So that's basically what I do. I also have a strong passion for health financing, and that is where I will say my core skills are: health financing and health policy. How did I get here? Two events in my life impacted that. One was the crazy long post-part 4 breaks that we usually have. I think ours was in 1999 or 2000. I can't remember the year particularly. And we had to take time off school. And my mom and my sister were already in the US. So I came over to the US and joined them. At that point in time, I started getting disillusioned with IFE particularly, and was like, why do I have to spend 6 months at home doing nothing? And then I started doing research, studying and stuff like that. I tried to leave IFE at that point in time, sincerely, but it just didn't work out. Then I went back to school. I went back, we resumed, went back. Then it was great. Year 5, year 6, as it went along like a breeze, except for a few bumps compared to where we're coming from. And we graduated. Sincerely, I wanted to, when I started out, I wanted to be a cardiologist. What Lola is today was what I really, really wanted to be. So be a cardiologist, be interventional cardiologist, and all of that kind of stuff. I graduated from medical school, went to Jos University Teaching Hospital for my internship, and that's when everything unraveled for me. So my first rotation was pediatrics, and every time I was on a pediatrics call or was in the clinic, it was always a child with malaria or something of that nature. And there was this particular child. So children coming with malaria, you treat them, 2 days they're out, 2 days, 3 days they're out. And there was this particular child that came in, and this child was on the ward for 2 weeks. And at that point in time, I started asking a lot of questions. That why do children have to always come in, bear the brunt of a broken system, and some of them die, or some of them have to go through this pain? Then the second piece of it was that, do we not have systems that can actually prevent people from coming into the clinic, rather than we being at the receiving end as doctors, as nurses, and we have to right that wrong and things like that. Some of them came in a couple of times like that, and they became regular faces that you knew them. Throughout Ife, it never just struck me as anything being different, but in how during my house job, that was different. And that was when I started like, there has to be something different. So during the house job, sometimes you have extra time on your hand where you're not running 48-hour shifts. So I started looking and just started asking questions. That's how I discovered that, hey, I could do a master's in public health. So I did a master's in public health. I applied, did my GRE, and applied for a master's in public health at Hopkins. I actually applied to Hopkins, Columbia, and Harvard. And I was like, hey, I'm from Ife, I must go to the best schools, basically. Harvard, for some reason, they rejected my application. I was like, I'm sorry. And I went to, and then Hopkins accepted me. And I was like, okay, fine. If number one at that point in time could accept me and number two will say no, then there must be a problem with number two. So I went to Hopkins. It was a rapid program, 1 year, basically like 10 months, basically. Before you know it, you're out. But a couple of things I learned while I was at Hopkins, that was where the Foundation for Health Financing got laid. My understanding of health systems. I did, I read a couple of opinion editorials that I submitted.
This is master's at Johns Hopkins.
Yes, this is master's in public.
Sorry, can we have everybody mute themselves if you're not the one talking, please? Thank you.
We'll take questions at the end.
Yeah, sorry. Sorry about that. Yes, master's in public health at Johns Hopkins. So sorry for using that, just using abbreviations as well. Yeah, master's in public health at Johns Hopkins. So I did that, graduated, but that was when I started understanding more about health systems, about health financing, and the other side of healthcare that we never learned about while we're in medical school, or we were never exposed to. Then after that, I joined the US government, I joined a fellowship with the US government. And it was a 2-year fellowship in a particular organization that was like the primary healthcare organization for the country. I call it a mishmash of many programs. There I learned what primary healthcare was. I learned about HIV care. I learned about recruitment, as in healthcare workforce recruitment and all of that kind of stuff. I learned about organ donation, transplantation, and all of that kind of, all the policies that behind it. Basically, it was a really, really great experience. I worked for the government for about 5 years, US government for about 5 years in different roles. Then I felt that I had a bit of that. One was because it was slower paced and I was young, and I was like, I really needed to do something that was more faster paced, and I could actually, that was a lot more along with my skill set and what I wanted to do. So left the US government and joined a consulting firm that was also working. I was a contractor to the US government. But in that area, I switched a little bit and worked on the Affordable Care Act. I'm sure many of you have heard about Obamacare. So I worked as a contractor in that firm. I worked in that firm on a particular aspect for the Obamacare project. And what we were doing in that particular role was actually identifying barriers to access within the health insurance scheme that was set up. So I did that for a couple of years. Also was exposed to what hospital acquired infections, did a study on that. So it was broad learning for me. At that point in time, I became restless. And I'm going to go through my history just to identify and also talk about some of the lessons I learned along the way, and some of the mistakes I made and things like that. I definitely then joined, I left that firm, then joined another firm. And that didn't last for long because I basically lost that job at that point in time. For some reasons, I still don't understand till today. And at that point in time, it was one of the lowest points in my life when you discover that, is it that I'm not good enough, or am I not smart enough, and things like that. And I really don't know. I made a phone call to a friend, and he was like, hey, Muyiwa, come join us in Nigeria, and things like that. That was how my foray into global health started. I joined that firm, worked for them for about a year and thereabout. I had to resign because of some personal issues that some of you are aware of. I took time off work to work for about a year, not to work for about a year and a half or thereabout. Then went back in, basically worked with a couple of firms until I landed this job. A couple of things that have been really, really key in my career has been, one, opportunity, two, restlessness. I at some point in time in my career, I was like, once I'm in a particular job and it doesn't fit where I want to be, then that's a time to start leaving or to start looking for something else. Then the third is also just the desire to be better. I have built a lot of relationships, and one of the things, so let me go back. When I came to Hopkins, one of the things that I learned, that a new term completely to us was, and my class had 27 Nigerians, I think. Yeah, we had 27 Nigerians. I think that was the largest Nigerian cohort in that class. It was something we learned. It was called networking. Foreign, completely, it didn't make sense to you. Networking basically, it didn't make sense to us. Basically was, you set up a lunch date or a dinner date or something of that nature with somebody, or just an hour or 30 minutes with a lecturer or somebody who's in school, or somebody who you find on the internet, you find on the web, and you're just interested in what they're doing, and you just go have a conversation with them. It was just crazy, as in, yeah, go to school, read your books, and move on, right? That was what a lot of us were exposed to. But this was really key. And many of us did not learn it until we had left school. And a lot of the jobs that I have gotten today have been one referral of the other. I think this last position I'm in is the only job I can remember applying for, and I got, basically, and I went through an interview session and things like that. The previous jobs I had gotten was make a phone call or reach out to somebody, hey, I'm looking, and the person says, oh, send me your resume. And I send it to them, and that's it. The second piece I talked about was just opportunity. Opportunity in the sense that I have always been on the lookout for what's the next thing to do. Why I really don't want to settle down in a particular place and say I spent 20 or 30 years in a particular organization. That has not been me. But just looking for the opportunities to stretch myself, that has been. So that's one of the second piece of it. The third piece has been, I would say, the grace of God. I'm a very strong believer in God's grace and God's grace upon my life. And I think that has been it. I've been through some terrible patches in life, lost my job twice, personal losses and things like that. But every time God has I've just had the ability to just dust myself off and move on. So those are some of the things that I really wanted to touch about my career in life, about my journey in life. What do I do right now? I work in primary healthcare, and it's just a big, how I put it, it's a big name for so many things that matter in life. Because based on primary healthcare, as we always say, is one of those things, one of that sector of the health system that is often neglected, but actually addresses 80% of our healthcare needs, healthcare needs of individuals. And so in this organization that I'm in right now, I'm privileged to be the deputy director for that organization, for that group. I oversee a group of over 100 people, work in multiple countries. And some of the things that we try to do is basically improve, as Lola had mentioned from my bio, is improve access to care. You'll be so surprised where people are in this world, and they need to get to a clinic, and the clinic is 30 miles away from them. and there's somebody who is in labor and needs to get to the hospital. And that's why you have your obstructed labor, that's why you have your bleeding in intrapartum or postpartum hemorrhage. And that's where a lot of those things come from. So a lot of things that we see in the clinic are a result of the things that happen outside. And I went on that course. I feel that when I started down that course in particularly post OAU, post JOS, and post post Hopkins, I began to see that there were a lot of things that I could do in my particular sphere, rather than going through residency and just becoming a specialist and things like that. I just discovered that that wasn't me. When did I make that final decision? Maybe like 2 years ago, because I still actually thought about doing residency some years ago. But I think the more over time it became more and clearer to me that this was where I was, that I could actually add value and I could actually add a lot of impact and have a lot of impact. And that was, and for me, it's been really great. It's been really exciting. And it's been really interesting because there are different, I look at the healthcare system. I have a better understanding of the healthcare system, what underlies how a clinic operates, what impacts populations that drive to the clinic, and what impacts so many things, how a clinic is funded right now, why we don't have a lot of staff in clinics, why we don't have, it's just so many things. And for me, it's been really great. It's been really exciting. I just see a lot of potential for myself and things like that. I'm going to stop it here because I know there'll be a lot of questions, but yeah, that's a little bit about me. And for people, and I'm just going to say, before I stop, I'll say that for a lot of people, you are getting to that point where you're going to be asking yourself questions that what do I want to do in life? House job consolidated that for a lot of people. For me, it unraveled it and was just like, it just broke it completely. That, are you sure you actually went to medical school? When you went to medical school, you're going to be able to do it. And that was when I started asking a lot of questions. That was my own journey in life. I know a lot of people are at that point where you're asking different questions. You might still be in clinical medicine, and it might be that you discover or you find out where your clinical passion lies. But for me, it was just an about turn, and that why did I even go to medical school to do this? But later on in life, I saw why medical school became a foundation for everything I'm doing right now. So I'm going to stop it here.
Thank you, Muyiwa. We'll take questions shortly. If you have questions, additions, go ahead and start typing them in the chat box. I just wanted to reiterate some of the points that I took from his discussion. The first being what to do in life. There's so many of you that are still in Ife Med School. Some of you are recent graduates, and some of you are even in your house job, already on a career path, so to speak. I want to emphasize what he said, that when he was at his house job, he began asking himself questions. And I think for a lot of us, when we graduated in 2005, we felt that we had lost a lot of years. We were like, what do I do with this medical degree that is in my hand? How do I make something out of it? This is a 6-year course that I ended up being 10 plus X. What do I make about it? And he said one of the pointers was restlessness. Like, I don't feel comfortable here. I don't like where I am. And he began asking himself questions. So that might be a starting point. That might be some of the soul searching that you need to do. What do I like? What do I do with this medical degree that is in my hand? What are the opportunities that I have? I'm going to use myself as an example. I did not initially plan to be in the US after graduation, but somewhere in my 5th year, I got the opportunity, and I found out that I was going to live in the US after graduation. And so I began to plan my life towards that. When I got to the US, there were several of my colleagues that had come ahead of us, and they were already into USMLE and what have you. And I was scared. So I told myself, what do I like? What don't I like? I knew surgery was not for me. I hated surgery, so I X'd that out. I liked OBGYN, but the information I heard about OBGYN in the US frightened me. The litigation, they can still sue you up till the child is 18. So that frightened me. So I put a big question mark on OBGYN. And then I was left with peds and internal medicine. And one day my husband asked me, what if you had the opportunity to go do everything all over again? Do you think you'll be able to make a better decision? And I was like, yeah, maybe. So I added family medicine into my applications because of that, because it gave me an opportunity to, so to speak, go through everything all over again, go through peds, go through OBGYN, go through surgery. And at the end of the family medicine residency, I was able to make a decision for sure that I don't like chronic medicine. I don't like high blood pressure, diabetes, hyperlipidemia every day of my life. I had to find something to do with the medical degree and the family medicine residency that I had. I believe that's what he was trying to say. Ask himself questions, get restless. The second thing I want to also emphasize is this issue of networking. Honestly, as Niger graduates, that thing is foreign. Never heard of it until most of us stepped out of the country. In Nigeria, in a way they say it's man no man. But man no man is crucial. It's crucial. And you actually have to now put yourself out there to no man. Even if there's nobody that will connect you, you go look for these professors and these people that are sitting minding their business, and you push yourself in their face. This is me. Meet me. These are the things that I'm interested in. These are the things that I'm considering. Rub off me, share your life with me. And I also believe that this OAU Med Talks series and the mentorship program was also a platform to enhance such networking.
Exactly.
Opportunity, some of us will get the opportunity to travel out, some of us will not. But I believe that even wherever you are, wherever you're situated, these principles still apply. And then again, he mentioned the grace of God, and I don't think anybody that was born, raised, educated in Nigeria can underestimate that, whether you're Christian, Muslim, or whatever religion that you practice. There's just this core about God that is in us, and I think everybody should tap into it and make use of it. All right, the questions we have.
Yeah, Lola, let me just speak about networking a little bit, then I'll go to the question. I see one of the questions here about financing.
Yes.
Yeah, let me respond to that, sorry. So talking about networking, and the good thing about it right now is that I will encourage people is that there's LinkedIn, then also there's this this Med Talk thing that we have right now. Let me give an example. There's this guy who reached out to me, looked at my profile and just reached out to me and said, hey, Dr. Tegbe, this, that. I'm a graduate from Hopkins as well. Could you just spend some time talking to me and stuff like that? Okay, I'm like, fine, let's talk. And he was like, okay, there's this opportunity at your job that I would really like you to, that I'm really interested. I'm like, hey, dude, just apply and all of that kind of stuff. So after we spoke, he applied and he sent me his resume. So I was like, okay, this resume looks kind of sharp, right? So I sent it to the lead of the health team. I was like, hey, I spoke to this guy, LinkedIn, I met him or he reached out to me on LinkedIn. I kind of like that he reached out and was actually able to put himself out there. Put him through the process and stuff like that. Ladies and gentlemen, this guy got a job offer, started last week Friday. He started last week Friday, because when he got the job, as when the person interviewed him, she was like, this guy is great, as in completely great. And that was how the process went through. So that's the benefit of networking, right? If he had said, okay, he was just going to stay in the system, maybe he could have risen to the top. But somebody looked out for him, as in somebody was saying, okay, let me see this guy that Muyiwa brought, as in is telling me to look out for, and we're like, this person's totally brilliant. So that's part of the value of networking. So yeah, Lola, to the questions.
Okay, so what advice would you give people who may be financially challenged, considering chasing some of these dreams cost a fair bit?
This is what I will say. If I have to rewind my life and do it all over again, maybe I might not have done a Hopkins degree. Maybe. Do you get? Because it is expensive. I spent $70,000 on that degree. And I know that it's a lot. That's $70,000 then, not stock of now. And I know that it is a lot. So what I advise people is, one, look out for 2-year degrees, 2-year programs, which are usually less expensive. That's number one. If you really, really say that that's what you want to do. 2, Europe is a lot cheaper than the United States. It's a lot cheaper than the United States. So if we're talking about where you can go get the biggest bang for your buck, there are a lot of European schools that you will get an equally sound education, right? And also have that degree. Secondly, I always tell people that there is no race. We're not all running, as in there's no hurry in life, sincerely. If you feel that, I always tell people that save your money, get into, there are some of my colleagues that did not join that way in Hopkins together. They were 5 years post-graduation. I think I was one of the most rapid because I didn't even do NYSC. I didn't do NYSC. I did house job, just left. I was one of the fastest, right? Some of my colleagues went back and did NYSC and all of that kind of stuff, but I didn't. So take your time, and once you know what your limitations are or what you can afford, plan it out. I know that it can be a little bit difficult, but you just need to strive at it, because once you set a goal for yourself, then you work towards it, and just once you work towards it, you will definitely get it. And the truth of the matter is that there are a lot of opportunities out there, right? Keep looking out. There are a lot of schools that offer scholarships for people who are doing graduate education, particularly in Europe. Then also, even in the US, whenever you're applying, always ask for funding. Do you get? That was one mistake I made also. Always ask for funding. Push them, right? Push them to say, okay, I cannot afford this and things. And do not be afraid to defer your admission, sincerely. If you get admission in year one, if you get admission in year one, I don't get it, at least you have the admission. You can defer. At least you can. I think in some schools you can defer up to 3 times, 2 or 3 times also. So I think there's a way that you can go in, and pace yourself such that you don't come out and take on loans, you don't kill yourself, or you don't sell, or you don't put yourself under undue financial pressure. And while you're trying to pursue your dreams, yeah.
Okay, thank you. There was another question about lots of students interested in public health. What opportunities are out there that they can explore now while they're still students? They want to get them on a fast lane.
I think if you're interested in public health, you need to start exploring the field of public health. So public health, when I got into public health, I was like, okay, public health. I didn't know the depth and the breadth of public health. There's one of my classmates here, James. Many of us got in, he's from Tanzania. Many of us got in and we're just like, okay, this public health thing, let us even understand it and things like that, right? And that's when we begin to discover there's epidemiology, there's population health, there's biostats, there's so many things. There's health policy, there's systems, there's health financing, and different things. But the good thing about it right now is that there's a lot of information out there, right? So one of the things I'll advise, jump on Coursera. That's one of the most free, as in most learning platforms that is really, really widely known. Jump on it, take a number of courses or stuff like that, and just do research. You guys have the internet now. When we were in school, we didn't have plenty of internet. We didn't have a lot of that, right? You guys have the internet on your tablets, on your phones and stuff like that. Who was it that was always the gatekeeper? That's Ifumsa plays the game. And just do your research and get and hone down your skill and decide on what area of public health you might want to. Do not come in, as in, I wouldn't advise coming in as a generalist to say, okay, I just want to do public health, whatever it is, wherever it lands and stuff like that. You might take a while before you get to land where your niche is. And it's so wide, because it can be child health. You're talking about immunization systems, supply chains. You could do all of that. It could be health financing. Even health financing, you do a lot of that. Even health economics can also link to public health. So there's so many areas, but I would say just dive into it, start understanding or start reading. And hey, I'm here to provide as much guidance as possible.
Very enlightening. Never knew public health is that diversified. We all just thought Komobe, you know, that was what we thought it was. And there is a suggestion here that there's a good and free program at the Hebrew University IMPH. So you might want to consider that and look into that. It comes with a scholarship and it is very competitive. Someone said you should enlighten how medical school training contributed to your current role. Oh, sorry, before Muyiwa, you answer that. The Hebrew University is one of the top 100 universities in the country. Admissions are currently open, and the link is in the chat.
Yeah.
Go ahead, Muyiwa.
All right. So
medical school training, how did it contribute to your current role? So
at the start of my career, it wasn't a whole, as in I would like, at some point, that was when I started questioning that, why did I waste my time going through medical school if this was what I was going to do, right? But what I discovered was that it started distinguishing me. Because when people are talking about when they're talking about public health, in the public health parlance or sphere, I was able to always zero back in on the patient. So that was where my skills or my medical school training or my outlook was a little bit different. When you're talking about quality of care, you're talking about multiple systems, you're talking about trainings and all of that kind of stuff. But I'm like, the question I always brought them back to was, how does it impact the patient? Because sometimes when we think about health systems, and that's a mistake that a lot of health systems and health policy people make, we think about the grand system, but we don't center the patient, right? So the patient was always at the core of a lot of the conversation. So when I discovered that, and a lot of people, I think some of my mentors also were able to say that, well, you have this, always try and always build upon it. So I basically just zeroed in on it. Whenever we're having a conversation, it was always bringing out the clinical side, the clinical skill side of it and things like that. One example was that particular project that I told you that I mentioned that I worked on with for Obamacare, we had to do clinical journeys. Basically, I develop what a model patient was. So there were 4 disease areas that we're looking at: HIV, diabetes, I think hypertension, then I've forgotten the last one. It was 4 basic. So I had to develop that. So basically what symptoms might look like, what signs might look like, what medication might be like, and things like that. But at the end of it, it was to inform how will that typical patient have access or not have access. So it was really important at that point, and that was one of the areas where I was able to hone those skills a lot. So making that connection between my medical training, right? My medical training and being a medical doctor and linking it up to public health, looking it up to what I do when I talk about health systems, when I talk about health policy, was always very, very important, was very, very key. So I could easily make those connections. So I think to answer your question, I think always remembering that foundation and not letting go of it. So it's if you go into IT completely or into another field, I think I might struggle to find make a connection with that. But for me, it was always easier for me to be able to pull the patient perspective in, or the outlook for the patient when it comes to that.
Both sides of the coin, I guess. The next question says, what is Coursera? Never heard that too before.
I just dropped the link in the chat.
Okay, all right. I guess that's homework for everybody. Then how can we combine love for clinical medicine and still be involved in public health, especially if public health is a long-term plan? I think he already kind of answered this question. The clinical medicine gives him the background, and he's able to now explore both sides of the coin, so to speak. He's able to piggyback on the clinical side and use that in making decisions, or in being able to contribute or being able to say into certain decisions that are making, where someone who never had the clinical side of it might not have that knowledge.
Yeah. Yeah, Lola, if I may add to that, there are some people who still do clinical medicine, right? They go do their residency, become specialists and stuff like that. Then circle back to start doing public health, as in get a master's in public health, and then might actually leave clinical medicine. I know I have a lot of friends who have done that. So it depends on, I think it all depends on the person, how you want to approach your career. For me, it was that this was just my decision. If I'm going to circle back to doing this again, why don't I just start on the journey, right? As in from the get-go. That was for me. A lot of people consider the financials. You go do your residency, you become a medical doctor. You become an attendant. You're earning a lot. As in sincerely, you're earning a lot, and and so it's either the financials or what you want to do. But for me, I was just like, hey, let me just start on that journey and start moving in that direction. Yeah. So it could go either way. Yeah.
Any internship opportunities for people who are interested in healthcare financing in Nigeria?
Let me get back to you on that. Let me get back to you on that. Yeah, there are a couple of organizations that do healthcare financing, but it's still a rudimentary field in Nigeria, and many people, internships generally in public health are very scarce in Nigeria, but also for health financing, that is a little bit of a niche field. Not so many organizations. So I will need to, let me get back to you on that particularly. Yeah.
Okay. I think Dr. Olasende is reposting his question about medical students that are interested in public health, and they're wondering how can those students start exploring opportunities now? What opportunities are available for them to, I know you mentioned Coursera earlier, but what can they do to kind of like be one step ahead?
So if I, looking back at that, on that question, one example is, and thanks Dr. Olasende for raising that, you do a lot of research. That is one area, right? That could be an area that people, so public health is very, very research heavy, very, very research heavy, very, very evidence generation heavy and things like that. That is one area, as in explore opportunities for research, but in schools, in looking at what Dr. Olasende is doing, though he's might be a little more surgical or more clinical, but there are areas that you can actually ask a research question and think about it. So research is one area. Number two, we usually have these holidays or time, sometimes that you're out of school or things like that. I'm looking out for internships as well with public health organizations or organizations that do public health work, right? Then also networking with a lot of your lecturers who are in community health. And I'm going to say it openly, I apologize to all of them that we made fun of while we're in school. We basically looked at that department as hey, whatever, right? It was just one of those things that he needed to do, not knowing that some of us are going to circle back to it, right? But I will say that network with a lot of your lecturers in community health, right? Some of them have become mentors and have become mentors to us, right? And those who have provided guidance in our career. So I would say networking with them, then also looking out for those organizations, like I said, that a lot of organizations that do work in public health, there are a lot of them in Nigeria, and actually look out for internships or look for opportunities to partner with them.
Okay, I have a question for you. For persons who may not necessarily be recent graduates or who already started residency and are getting that restlessness, like they're in the wrong place, and they're now considering pivoting to public health, how can they navigate that? What do they need to do to explore if that's an alternative option for them versus what they're currently doing?
So thanks a lot for that, Lola. I think generally what I've seen a lot, like I said earlier, is a lot of people now come back and actually either go and do a master's, right? They go back and say, okay, I have some time on my hands now, or I just really want to go into public health. So many people that I see go back and do a master's, right? Some people decide they want to go and do an MBA, or some start pivoting towards, even while they are clinical they're clinicians, they start doing more community health, like public health activities. I have we have a family friend who she's Indian and she is an OBGYN. But for a couple of months in the year, she actually travels to either to an African country or something of that nature, and just go out there to do work. So those are some of the opportunities. Those are some of the ideas I have seen that people have done. Some people just leave, take a job in a public health agency, right? Because it's always, the complementarities are there, as in the overlaps are there. So you can always switch over or take a role in that. So those are some of the options that I have seen. Yeah.
I mentioned that because a couple of while ago, I met a lady who is a Nigerian medical graduate, but worked at the CDC as an epidemiologist.
Yeah.
And she mentioned the CDC offered a position for doctors. You're already a clinician, you've done residency or your fellowship, whether in the US or not. And then you're coming into the CDC to work. And according to her, they valued that much more than those of them who just came in directly and did not have the clinical experience. Now, I think there had to be a training of some sort. It was a 2-year training with the CDC, and they had very strict requirements. You had to be less than 40, you had to live within a certain mile radius, and you had to take that training with the CDC. And after that training, they could post you anywhere in the US, even if it's rural, and you have to be willing to go. And I wanted to ask if you were aware of that, and if that was something that you could also share with our audience.
Yeah, I'm not very familiar with the CDC program, but I know that the CDC has a slew of programs that are targeted at foreign grads, foreign medical graduates particularly, and that offer that opportunity. A couple of our IFE graduates actually took, particularly the class after us, the 2006 and 2007 class. They actually took advantage of that. I'm familiar with some of them that actually did that. One example of the program is called the Epidemiology EIS Fellows. I'm blanking out on the
I think it's a fellowship.
Yeah, it's a fellowship. So they're that. Then do you, if you remember Simon?
I don't.
Simon Adibola.
Oh, yeah.
Simon Adibola also he was an informatics fellow. So he took an informatics fellowship, I think. So there are quite a bit of them and CDC, the Centers for Disease Control and Prevention, based out in Atlanta. So they have, I'm not very familiar with them, but that's another resource to look at, and that you can actually that you can check out. Now, there are people, I'll look out for Simon, Google him, he's on LinkedIn, and tell him that I said that you should reach out to him. So Simon is one of them that's taking advantage of that. He's no longer with the CDC, he's working with another organization right now. But yeah, those are other opportunities that could be, that people could take advantage of, yeah.
Thank you so much. Some of our students are asking for the best approach to link up with the alumni. The OAUmedtalks website has been pasted on the chat. So you could always use that. There's a Facebook group and there's an Instagram group. There's also Twitter, and any one of these will be good access point to contact the OAUmedtalks. And again, like Muyiwa mentioned earlier, there's a mentorship program where you're interested in this particular track and you just need someone to, what was that word you used again? Network with.
Network, yeah.
Someone to kind of like rub off on you, share ideas with you, share your journey with me. And we could do that, and we could help guide you and give you good advice on mistakes that we make, and successes that we make, good decisions that we make, so that would shape in your own journey. Thank you. EIS, that was the CDC program that I was trying to remember, the Epidemiology in Intelligence Services. It was a 2-year fellowship, and they have very stringent criteria for you to apply, but they were very interested in international medical graduates. So for those of you who are also considering US, that might be something to look into.
And if I may add, regarding that, the EIS fellow, people should be on the lookout for that. With COVID, with a lot of interests right now with COVID, then there's also a lot of interest in people talking about I'm sure you've heard about decolonizing global health and things like that. I have my own ideas about that, basically. But there's a lot of interest in building up capacity in country and capacity of foreign graduates, right? To actually be that workforce that would change global health, as it were. So there are a couple of opportunities upcoming, and it would just be great for people to check out universities, usually USAID, CDC, and things like that.
So the CDC, to the best of my knowledge, I'm not quite positive that they help with visa sponsorship and things like that. But this is something where if you were already considering, say, an NPH in the US, you come in, you do that NPH, you're already in the country, and then you could go into that fellowship and you get, I think it's a J visa of some sort, and that will give you the time and the education that you need. And sometimes all you just need is one leg in. And once your first leg is in and you continue to network, you will meet with people that would show you how to go or walk around the immigration aspect of things. So we got to round up. If you have any other questions, please.
Sorry, Lola, I think there are 2 other questions there. Sorry to interrupt.
There are 2 other questions that I haven't addressed. Go ahead.
There's one about, are there any opportunities for those interested in IT to leverage on medical knowledge, and how feasible is it taking that along with a clinical practice?
That's an excellent question. Informatics is one area. So informatics is just basically a person who has a health background, a data geek that has a health background, right? And there's a lot that's and I think there are a couple of fellowships, particularly, that actually target that are looking for that. So informatics is one area, and now there's also interest, particularly a lot of interest in data science, AI, that's artificial intelligence, digital health. My organization actually has a huge program. We call it the Center of Data and Digital Excellence, that is basically geared towards that. So more and more, more and more, the role of IT and data, or let me call it digital health, and regular healthcare is beginning to intersect, because one of the things that COVID taught us was that you can reach more people on their phones by phone calls and things like, rather than having people come into clinic, and you can actually deliver effectively through over digital platforms. So it's a growing field, and it's something that, hey, think about it. And if you still want to talk about it some more, please reach out to me. I can link you up with some people in my organization that can serve as mentors or provide you some guidance around it. Then as I talked about data science, also people who have interest in data science is basically crunching numbers, epidemiologists and things like that. But that's also another growing area of healthcare that is there out there. Yeah.
Okay. I don't think there's any other questions that I'm missing again. Is there?
I think you've covered the question. Sorry to interrupt. But I would also like you to speak some about healthcare financing in Nigeria, because we know that not everybody would be in the US, and these students are also in Nigeria. I know of the NHIS, if you Google anything about healthcare financing, there are professors, although it's a lot in the academic area, but there are professors and there are lecturers that do a lot of research in healthcare financing, or work with institutions or systems or NGOs that do healthcare financing policy management in Nigeria. So the easiest way to do is either go to LinkedIn or look at their publications, which give you the names and their locations, and then trace them back to Google, find a way to link up with them, and then find out what they're working on. They might have a project. You can be a research assistant, add that to your CV, or you can work on whatever project they have, and expose yourself, and therefore build up your skills in healthcare financing in Nigeria, so you can practice also in Nigeria.
Yeah. Talking about professors, Tayo, thank you so much. So there's somebody that readily comes to mind. He's at UNN. His name is Professor Obina Onyejekwe. He's a health economist, and he does a lot of work in health financing. So that'll be somebody that you can reach out to. He has a good track record in Nigeria and internationally. He's one of those people who has stayed in Nigeria and has carved a niche for himself. So that'll be somebody that you can reach out to. Then also, I just remembered right now, there are a couple of health insurance schemes that are coming up all over the place in Nigeria, particularly the state health insurance schemes. Oyo has one, Osun has one, Lagos has one. Lagos is the most robust, basically. And I think I know someone who actually did an internship there with them. So those are organizations that you can also reach out to, particularly explore to find out if they have internships. And some of them could be, or you could find a way post, how will I put it, either post house job, right? Like your NYC to do that if that's a stage at which you are, or to actually do an internship with them. So those are the other places. The thing with health financing also is that, like I said earlier, it's quite rudimentary in Nigeria and hasn't grown, it hasn't blown up full-fledged, and it's still we're still learning it. And I think Sheikayede, who is on the call, understands what I mean by that. So we're still learning it, the policy aspect, and there's so many aspects to the claims management and things like other different aspects to it. They're still very rudimentary. But if that's an area of interest, those are some of the places I can say that, hey, take a look at and start and explore it. Yeah.
All right. Thank you so much, Dr. Muyiwa Tegbe, for this talk. I learned a lot. It's been very informative. The talk is recorded and will be found on the OAUmedtalks, I think within a couple of hours. So you can always refer back to that if need be. You could share with your colleagues who did not quite make it today. I want to thank all the people who have had questions, all the contributors, everyone who's here. Thank you so much. Enjoy the rest of your weekend and have a blessed week. Thank you.
Thank you, Lola. Everyone. Thank you, Muyiwa. Thank you. Let's clap for the boy.